Hi, my name is Tykera Cunningham, and today's date is September 15th. And today I'm going to be changing a central dressing line on my patient here. We've already went over the procedure. I've already introduced myself to the patient, and I've already gotten 2 patient identifiers, the name and the date of birth. So I'm going to begin by providing patient privacy, hand hygiene, So I'm going to begin by taking off the old dressing that's on my patient. Alright, so now that I have these on, I'm going to start taking off this dressing. And as I take off the dressing, I want to make sure not to pull the patient's skin. So I'm going to gently pull the tape and gently press down on the patient's skin, because this could be painful to the patient. So as I'm taking this off, I'm also observing my patient's IV site. I'm checking for any redness, any drainage, signs of infections, or any of those such things. And as of right now, if I were to see any drainage or signs of infection, I would take a swab, and I would save it to after the procedure, and I would notify the physician and see if he wants me to get that sent to lab for a culture sensitivity test. So now that we have the dressing off of it, I am now going to open my dressing changing kit. So now that I have that open, I'm going to take out the mask. So since I already have on a mask, I'm going to give this one to my patient. And he's going to put this mask on, and he's going to turn his neck the opposite direction. So now that I have that, I'm going to put on my sterile gloves. I'm going to perform some more hand hygiene. I'm going to begin. Okay. In this glove, it rolled. In a hospital setting, I would definitely get rid of these and re-glove myself. So now I will get rid of this and throw this away. Now I will go into now that I have on my sterile gloves, I'm now sterile, and now I can go into my kit. I'm going to set up my sterile field. And I'm going to begin taking out the objects that's in my container. So now that I have these objects out, I'm going to go ahead and open up my ChloraPrep swabs. And I'm going to begin with cleaning the insertion site. And I will clean in a horizontal, vertical motion for 30 seconds to 1 minute each time. We'll get rid of this. I'll do it again for 30 seconds to a minute. Throw this away. And then the last one, I would do the same exact thing. The only difference is I will now start cleaning the catheter lines as well. And so now I will let that dry for 30 seconds to 1 minute. Also, before I started cleaning and putting on my sterile gloves, I would also measure the insertion of the catheter down to the proximal line. So I will measure that as well with a measuring tape. And that would have been before I put on my sterile gloves and things like that. So now that this is dry, we don't want to blow on it or fan it or anything. We just want to let it air dry. So now that it's dry, it's time to put a new dressing on it. So with this dressing, I'm just going to place it right over the insertion site. And I'm going to just take this off. Make sure it's secured on there. Next, I would rip this piece off. And this is a little section where we can write our name, the date and the time the dressing was changed. So I would write that on here, and then I would apply it to on top of the dressing that's on the patient's neck. And it would just say my name, the date, and the time I applied this dressing. So now that the dressing has now been applied, I'm all finished. I would make sure my patient is okay. Then I would document how well my patient took the procedure. I would document any drainage, the characteristics of the drainage, such as the color, the amount. And I would also notify my physician about the drainage and see if he wanted me to send that swab to the lab. And that is how you do a dressing change.